Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and today I'm going to talk to you about dental cavities, everybody's most dreaded fear. And I'm going to talk to you about what they are, how you get them, most importantly, how to avoid them. Let me first off start by saying the tooth, the enamel, the coating of the tooth is the strongest part in your body. It is flippin' strong, and it is made out of minerals. And it's actually the biggest component is something called hydroxyapatite. And what that is, it's basically a strong mineral that makes your teeth and your bones really, really strong. So what happens is if we're eating too many sugars, which we do a ton of here in America, too many sugars, or you're not brushing properly, or a bunch of different factors, what happens is you have some bacteria that's in your mouth. Bacteria is always in your mouth, it's not necessarily a bad thing, but if you're giving it a lot of sugar, you're giving it a lot of food, and that bacteria grows and grows and grows, and it gets more and more and more. And what happens is it starts to eat away at the tooth. So the bacteria starts producing these actually acids that slowly eat away at the tooth. So say you're a very healthy individual, you have some sugar, no big deal. You brush away the bacteria, you brush away the sugar, no big deal. It may eat away a little bit, but by the time you brush it away, your saliva remineralizes your tooth, no big deal, you're good, no cavity. But if your teeth are really crowded, or you don't brush properly, you don't floss properly, you have this sugar that goes under your teeth, and you have these bacteria that are eating away that sugar, creating this acidic environment, and it slowly eats away at the tooth. So like I said, if it happens for a little bit, not the end of the world. But if this happens for weeks and weeks and weeks, that small little erosion of the tooth gets bigger and bigger and bigger and bigger and bigger until you have a full-on cavity. Okay, so now we know what a cavity is, how it's made. So let's see, can we reverse it without the need for drilling? And the answer is yes, we can, if it's small enough. So here at Thrive, we do this all the time. Patients will come in and they'll have, maybe a couple cavities, but some really, really small cavities too. And if they haven't gotten that big, you can actually remineralize that tooth to make it healthy again, which is bonkers. Our teeth are amazing, our body is amazing. So it actually remineralizes the tooth so that you do not need to drill it out. And how that works is basically a tooth gets eaten away, but just a little bit. And if we clean everything up, we get rid of the bacteria, we get rid of the sugar, all the bad stuff that's there, the fluoride and all the other minerals can actually remineralize that area if it's small enough to make it healthy. So there you go, you can fix it without drilling. But if it has gone too big, there's no amount of remineralization that is gonna help you. So normally we say you have 3 layers of teeth. You have the enamel, the outer layer, you have the dentin, the inner layer, and then you got the pulp and the nerves and all the blood vessels in the inner layer. If it eats away about half away that enamel layer, you're done for. It's gonna keep growing. If it goes past the enamel layer into the dentin, then the dentin, it's gonna spread like wildfire because enamel is super, super strong. Dentin, a little bit strong. So if it goes through the harder layer, by the time it gets to the dentin, it's just gonna spread like crazy. Then it's gonna spread to your nerve and your blood vessels and to the rest of your body, which that's why people need to get their cavities fixed as soon as possible, because you don't wanna have this kind of like systemic infection because of a cavity. All right, so some of you may come in and you say, hey, you know what, I have 3 or 4 or 5, 6, 7 cavities, but I don't really feel anything. Is that normal? And that is normal sometimes. Sometimes you have these smaller cavities that you don't really feel, but they've actually gone too big that you can't just fix it without drilling. The worst thing that can happen though is sometimes you'll have this throbbing feeling in your mouth, and it just is super tough. It hurts like crazy, but then it goes away. And then you're just like, oh my gosh, I cured myself. I don't have cavities anymore. This is amazing. But that's actually not true. What normally happens is that cavity is kind of grown. It made its way into the inner portion of your tooth, and it creates a lot of pressure because these are bacteria, but your body's trying to fight it. It's doing all this inflammation. It's making sure there's a lot of pressure in that tooth, but the bacteria wins every single time. The bacteria wins, and it grows and grows and grows, and it creates a lot of pressure on that tooth. And then eventually what happens, it kind of pops. It actually has like this pustule that comes out on the inner portion or the outer portion of your tooth, and it kind of pops, which relieves the pressure. And so you think, holy crap, I had all this pressure, but now I have nothing. and I'm good. But that's all that's really happened is now that pus and that gross and the bacteria stuff is now leaking from your gums into your mouth and into the rest of your body. So that is definitely not good. And then other times you'll just feel it. It might not be that bad, but you may be drinking some cold water or eating something sugary and you feel that sharp pain. And that can just be a cavity too. So there's lots of different ways you can potentially feel a cavity, but you may not feel it at all. So that's not necessarily a great indication if you have cavities or not. All right, so you may or may not have cavities, but you're probably wondering, okay, I don't want cavities, so where are they most likely to form so I can concentrate on that area? And in general, when you're younger, the cavities form on the tops of your teeth. And as we get older, as we get more and more adult teeth, they tend to form in between the teeth. And you may be asking, what? Why the heck? Well, that doesn't make sense to me. And it kind of does. You know why? Because in general, people suck at flossing. And so when you're trying to floss or lack of flossing, that bacteria gets stuck in between the teeth and it just kind of grows there and grows there and grows there until it gets into a cavity. When we're younger, we tend to actually have spaces in between our teeth, and that's why you don't get them in between the teeth as much. That's why you will hear every dentist talking to you about flossing, how important it is, because you can brush day and night all the time, but if you're not flossing, you're missing something like 30% of your teeth. So floss every single day if you don't want to get those cavities that are in between the teeth. All right, so you may be asking, Dr. Nate, I don't want cavities. What are the risk factors so I can avoid them, so I can not have cavities my whole life? And I will tell you that there's a lot of risk factors, but I will try to narrow them down a little bit to probably the most common ones. The one that we see, unfortunately, all the time in younger babies is from the bottle. So you do not want to have your baby go home at night. You don't want to have your baby to have the bottle in their mouth for the whole night. Because it doesn't matter if you have milk has lots of sugar. If you do actually sugary drinks in the bottle, anything you have that's going to have that sugar in their teeth or on their teeth for the whole night. And we see a ton of babies with these big cavities right in the front of their teeth, and that's because they had the bottle for the rest of the night or the whole night. Food is another big thing. Avoid the sugary foods. Okay, if you have a little bit of sugar, I have a sugar tooth. I like a little bit of sugar, but if you have it too frequently or too much, those bacteria in your mouth love sugar. So do not try to have it too much or too frequently. If you do, try to rinse out as best as you can. If your teeth are crowded, how are you gonna fix teeth or how are you gonna clean teeth if they're all crowded, you can't really get to them, you can't really floss them? Of course, the bacteria is gonna get in there a little bit more. If your brushing habits aren't very good, if your flossing habits aren't very good, if you have plaque or tartar buildup, it is kind of blows my mind sometimes of how many patients come in and they have tartar and stuff all over their mouth, especially with ortho, with braces. It's just everywhere. You need to be so diligent. And you got to get that plaque and that tartar off because that bacteria sticks to that. And we know sugar and bacteria equal cavities. That is not good. So you got to avoid those things. If you have other kind of systemic issues like diabetes, anything that's going to cause you to not heal properly or not be able to fight off that bacteria in your mouth, or anything that damages or hurts your saliva production, that is also going to make you more prone to cavities. So you got to avoid all these things as best as you can. Eat a healthy diet, brush, floss, come to your regular dental visits, and hopefully you will avoid those cavities. All right, guys, there you have it. It's Dr. Nate again, and I gave you the ins and outs. So now you know what a cavity is, you know how it's formed, you know how to avoid it. You will hopefully never get a cavity again, but if you do, and you live in the DFW area, come on in, we're gonna fix you up. Thank you so much for watching this. If this is your first time, please subscribe. As you know, I'm answering all these questions. I'm putting out videos every single week. So thank you so much for watching, and I'll see you guys soon.